This is Crystal Fenn with MedPage Today. I'm here at the American Heart Association meeting in New Orleans, where I'm speaking with Dr. Stephen Daniels from the University of Colorado at Denver about several studies that have been presented here with regard to the cardiac effects of childhood obesity. So, Dr. Daniels, what kind of cumulative message is coming out from these studies with regard to the effects on the heart?
Well, I think that we're seeing more and more overweight and obesity in children and adolescents, and the question has been, what kind of an effect might that be having on the cardiovascular system? So these papers presented today really show that obesity seems to be affecting both the heart and the blood vessels, and affecting them in different ways, both in terms of their structure, but potentially also in terms of their function, which would suggest that overall we might be seeing a premature aging of the heart and blood vessels, which, if it plays out over time, could lead to earlier cardiovascular events. And that would be a major concern, because we like to think of our children and adolescents as being healthy, as having healthy hearts. But these studies suggest that maybe we need to pay more attention to overweight, obesity, and risk factors like blood pressure, cholesterol, cigarette smoking, and that sort of thing.
Now, you've mentioned that the effects of this have not yet shown up in epidemiological figures as far as the rate of stroke, heart attack, things like that. But are these effects, such as the effect on the twisting ability of the heart to wring out blood, or on the effect on the walls of the heart, are those benign?
Well, they are not causing symptoms. So we know that the children that we're seeing now feel healthy and are active and that sort of thing. So they're subtle changes, but I think they're potentially important in terms of playing out with endpoints like myocardial infarction and stroke. The epidemic of obesity in childhood really has only occurred over the last 15 to 20 years. So we're really, in some ways, just seeing the tip of the iceberg, and the question is, as those children who are overweight and obese during childhood, as they become adults, what will be their outcome? And at the moment, we don't really know that. That's why these studies that focus on the earlier changes, I think, are really important, because they do suggest that we may have a generation of children that are at increased risk and could have earlier heart disease than their parents and grandparents.
So do these findings together suggest even further impetus for good exercise, good diet in childhood?
They absolutely do. I think that we, as pediatricians and as pediatric cardiologists, need to focus on prevention of these problems. We need to focus on having a generation of children where we are preventing obesity, making sure that blood pressure is normal and that cholesterol levels are normal. And when those things are heading in the wrong direction, we need to intervene to make sure that we're preventing the development.
Well, thank you, Dr. Daniels. I'm Crystal Fenn, MedPage Today.